Well, the silk peel has truly revolutionized the way I think of doing minimally invasive procedures for my patients. The unique aspect of it is it's what we call dermal infusion therapy. So it's unlike any other microdermabrasion. In fact, we don't even like to call it microdermabrasion because it takes it to the next level, because we're now talking about therapeutically guided silk peel skincare. What do I mean by therapeutically guided? If somebody comes in with true skin issues such as resistant acne, melasma, even fine scars, with traditional microdermabrasion technologies, we weren't really able to address those issues. They typically didn't go very much past the stratum corneum. So even though the patients really liked the way they looked, we weren't really going terribly deep and achieving what we call therapeutic skincare. With silk peel, we're able to infuse a variety of topical agents, which in my opinion makes the treatment much more effective and also long-lasting. So I've been very impressed with the silk peel for the treatment of fine pigment, even as an adjunctive treatment for melasma. We like it a lot for very superficial types of scarring, for pigmentary issues, for dullness of the skin. And my favorite approach is to use it in combination with other therapies that we offer in a dermatology office. For example, with the use of Botox and fillers, with the use of photofacials and fractal laser. I love using the silk peel as maintenance therapy after patients have had more aggressive procedures or even minimally invasive procedures. The main difference between the silk peel and other such venues is the safety, the efficacy, and also the fact that all skin types can be treated with a therapeutic approach. So one of the limitations we used to have in darker skin, there weren't many options. You could certainly have done microdermabrasions, but again, they didn't address some of the issues that silk peel addresses. So for darker skin pigmentary problems, very often I'll start with the silk peel even before embarking on laser procedures, and often some of the finer pigmentary issues in darker skin patients are addressed well with the silk peel, and it becomes an entree into more aggressive procedures because they like it so much that they're more apt to do photofacials or fractal laser or even resurfacing.
Excellent. All right, camera, speed, action.
The silk peel system has added tremendous revenue to my practice while I'm performing more aggressive procedures such as Botox, fillers, resurfacing, photorejuvenation. My nurse can perform silk peels, which adds a tremendous additional source of revenue. And as opposed to treatments which are not terribly therapeutic, the patients are getting tremendous benefit from the silk peel. So it goes hand in hand with what I do in the office. Because of it being a very safe system, I'm comfortable delegating the silk peel to my nurse, and I am there on site when the treatment is performed, but it is a very safe and effective procedure. In fact, before I embarked on treating patients, I started using it myself, and I definitely noticed a difference in my skin. There were very limited options for me in terms of some of the pigmentary issues that I had, and also the very fact that I am not a great patient in terms of tolerating pain. So this becomes a very nice procedure for your pain-sensitive patients who are seeking mild to moderate enhancement in facial rejuvenation with limited or recovery time. Another huge subset of people where this becomes a revenue generator, we have a lot of patients in our office who absolutely want no downtime. And I educate them about the fact that there are very few things that can give you therapeutic results with limited downtime. Botox is probably one of them, and silk peel comes pretty close in terms of simple, effective procedures where you can see a documented improvement in your skin tone, your texture, fine pigment, with little or no downtime. The only downtime I've ever experienced when doing these has been some mild flaking and peeling, which occurs a few days afterwards. The fact that you can treat all different skin types is a huge added bonus in our practice because we have different ethnicities. We have a significant population of Asian skin. Asian skin can be very difficult to treat with a lot of modalities because of the risks of hypo and hyperpigmentation. We've had no problems with hypo or hyperpigmentation in Asian skin. We're also able to treat all skin types, as I said, very safely and effectively without any adverse effects. and you can tailor the depth of treatment with what you're trying to do, which is unique as opposed to some of the other microdermabrasion systems, which are essentially fixed. So again, I don't like to think of SilkPeel as microdermabrasion. I think it should be in its own category, really as a dermal infusion therapy.